Good evening, everyone, and welcome to 12 News at 6. I'm Mark Curtis.
And I'm Karima Devine. An Arizona-based health share ministry faces community outrage after customers complain that their medical bills aren't being paid.
12 News journalist Katie Wilcox spoke with Solidarity Health Share members from around the country and here in Arizona who say the company just isn't delivering. Katie?
Yeah, a health share ministry is not health insurance. But in Arizona, health shares, including Solidarity, have no obligation to pay any part of their members' medical bills. And all payments are voluntary. Still, many members, that comes as a complete shock after they make monthly contributions and find themselves facing massive medical bills. Tempe-based Solidarity Health Share.
Solidarity Health Share is the solution to healthcare crisis in this country.
A nonprofit whose mission is to provide an alternative way to fund healthcare costs while protecting and practicing Catholic beliefs.
My wife said, we are not going to participate in healthcare anymore, in healthcare insurance. We can't morally.
Attracting members from all around the country.
Solidarity came up and it was Catholic, and I'm Catholic.
Proclaimed to be a Catholic company, and then also their monthly payments were something that fit within our budget.
The alternative Solidarity offers, it's what's called a health share.
The fundamental difference is there's no guarantee that they have to pay for anything. This is completely voluntary.
Joanne Volk studies health shares as part of her work at the Center on Health Insurance Reforms at Georgetown University. She points out these ministries look a lot like insurance, but they're not.
They have a lot of features that are very similar to insurance. There's tiers of coverage. There's a monthly amount that you pay, like a premium.
Members also have an annual unshared amount. It's like a deductible
that you have to pay out of pocket.
But when members get a medical bill, as the health share points out on its legal notice, their participants are not compelled by law to contribute towards your medical bills. Their role is to, quote, enable self-pay patients to help fellow Americans through voluntary financial gifts.
I mean, I think it's ridiculous because if I wanted to make a $570 a month donation, I wouldn't make it to Solidarity Health Share.
There's no obligation to pay for anything.
But I don't think consumers really understand how meaningful that difference is. There is no guarantee you're going to get paid.
For members like Courtney and Kim, that detail was a shock.
We knew it wasn't traditional insurance, but we didn't realize that they can just decide not to pay anything.
For Kim, it meant facing the full cost of her breast cancer treatment.
They need to explain their exact process and how much they are planning on paying of that bill before the patient, like myself, goes under a knife and comes out with a $144,000 bill.
$144,955. How much did you expect Solidarity would help you pay that?
Well, believe it or not, I thought all of it.
Kim found out about those charges back in September 2023. To date, she doesn't know if Solidarity ever paid $1 of it. Instead, the hospital forgave her debt as charity care, and Kim left Solidarity. Courtney says her remaining claims are less than $2,000, and they're just two of about a dozen Solidarity members the I-Team spoke with around the country, who say they're still praying their bills will get paid.
There's no guarantee you can get paid, and there's no way to, appeal a decision or a denial, really.
Solidarity Health Share wouldn't agree to an interview for the story. In an October report in Colorado, Solidarity said it had 19,000 members nationwide and boasted that their members shared nearly $24 million in medical expenses last year. They wouldn't answer questions about how many of their claims were denied or delayed.
Is a health sharing ministry ever the right option for someone who needs coverage?
No, if you are a person who needs health care and you're looking for insurance, it is never the option. If you actually need health care, you don't go to a healthcare sharing ministry.
Yeah, according to that Colorado report, at least 1.5 million Americans are part of a health share like this, which is down somewhat from 2022.
Yeah, and Katie, it's hard to imagine people at such a vulnerable time having to deal with something like this. So what do people do if they are left on the hook with these bills?
So those who tell me that their bills have been covered or cost shared ultimately said it sometimes happen after they complain. You can submit complaints to attorneys general, Better Business Bureau, and to the company itself.
But groups like Volks out of Georgetown, they want to see more transparency mandates like those regulations in Colorado and hope that more specific information will really help consumers make better decisions.
Yeah, and when you're facing a devastating illness, that is not what you want to be dealing with.
Yeah.
Katie, thanks.